we're excited. We're our first class is coming in the fall. We have specializations in education policy, health policy, environment, and social policy, pretty broadly defined, including immigration. And we're still accepting MPPs for a full ride. So if you know of anyone who's interested, just tell them to contact me, just Karthik, K-A-R-T-H-I-K, at ucr.edu. What I'll be talking about today are things related to some of the data work that I've tried to do to try to innovate in this space, and really to try to do a little bit of value add. I'm by no means a health expert, and I'm humbled to be invited to this conversation. The experience that I come in with comes from the think tank world. Before UC Riverside, I worked right after grad school at the Public Policy Institute of California, and there the key was to not just put out research, but make sure that it's accessible and understandable to a variety of audiences. So that's what we try to do with AAPI data. So if you just go to the next slide. What is AAPI data? Some of what we do is original research, but this is not high-end research. Again, I'm not a health expert or an education expert. I have a lot of expertise in immigration policy, but what we try to do is to put out data and summarize research that's been done elsewhere to give people at least a sense of the landscape so that they can dig deeper for more information if they want. That's what we did with our report with Center for American Progress, which is the state of AAPI's report that came out in fall last year. We also put out a set of fact sheets, and this is something that we heard time and again. When we try to innovate, we hear about a problem that exists. So people said, I just want to know some key facts and figures about a particular community, like Japanese Americans. So while our report is comprehensive and it goes by outcome, we also thought it would be important to put out fact sheets that cut the data a different way and make it easy to access. Next slide, please. Now, in addition to doing our own reports, we also serve as a portal to other reports. So, for example, and by the way, this is we're always looking to improve and expand on what we have here. If you go to our website, if you see that bar on top, where it says policy, you'll see health underneath that, and if you click on that, you'll get links to reports on the left-hand side, some key quotations, links to microdata, and some infographics, and I'll talk about those infographics in a second. Next slide. So with infographics, especially in this age of social media and very, very short attention spans, people don't, it used to be that people had the patience to read a 20-page report. Now they don't. And now, especially if you're trying to get information out there to legislative staff, even agency staff, having a kind of 2-page summary is often required. More generally, if you're trying to get the public interested in an issue, infographics. So I'll give an example on the left-hand side. Migration Policy Institute put out a set of numbers of state estimates of the undocumented population by different categories and dimensions, and race was one of those dimensions. So we took that data and just focused on the AAPI component and came up with a set of infographics, like the one you see here, and particular infographics for each state that has a sizable Asian American undocumented population. We promoted it through Facebook and Twitter, and it got a lot of buzz, and it was right on the eve of President Obama's announcement of the expansion program, and I got an interview in NPR Weekend Edition. So that's an example of something that's not even original research, but packaging information in a simple way can often help. On the right, sometimes it's good to even think beyond our normal sets of data. So if we think about health data, we might think about the National Health Interview Survey or the CHIS or some other health surveys, but sometimes you can find it using consumer expenditure data. So here's an example that uses that. It doesn't disaggregate, but still, it's a different look than what you might typically expect. And by the way, these infographics we can find on our website, and they're very high-resolution graphics that people can download. And I've heard people who've used it in their PowerPoint slides, and we're happy that it's getting used. Next slide. Another tool that we came up with is a quick stats tool, which you can find from our main page. And that essentially, one of the frequent things people said was FactFinder is really complicated to use now, and they just wanted to know some basic numbers, like how many people of this detailed origin are in my county. Here's an example by congressional district. These are sortable and downloadable tables. And so if you see, like, there's that Excel icon right next to the search button. So you can just download these state level, county level, congressional district level data sets, and we try to label it as accurately as possible in terms of what the data source is. Next slide. And then finally, for the kind of more hardcore data people, we've created a resource with NCAPA, which is the National Council of Asian Pacific Americans, which is a link to microdata. But essentially what we've done here is to classify all these data sets. So if you want to know what data sets have at least 50 Japanese Americans in them that you could potentially analyze, you click on that and you'll get a subset of all the data sets, including link to relevant publications and the microdata themselves. Next slide. So far what I've been talking about are ways that we have tried to make data more accessible to a wide variety of audiences. But an important part of taking it to the next level is data advocacy. And here, this is me personally, some of the things that I have done. Next slide. So California has a bill currently pending. I serve on the California Commission on APIA Affairs that helped craft this legislation that tries to improve on data disaggregation when it comes to administrative data as it relates to higher education and health. This is sponsored by Assemblymember Rob Bonta, and there was a prior attempt by Mike Eng in 2011 that included these state agencies, but it was deemed to be too expensive. California was still very much in the midst of its economic downturn, and so it got pared back to only including Department of Industrial Relations and Fair Employment and Housing. So the hope is this time with more resources at the state level that this can be done. But even in a state like California, where the API population is so big, it's a challenge to tell people that we have the biggest population of most Asian groups, and it's important to get a sense of how people are doing. The cost issue comes up. But we are aware of some limited successes elsewhere, like in Washington State and Oregon State. And one of the things that will be interesting and important to do is to see how we can learn from each other. The commission, I think, we have limited time to work on any particular issue, but we haven't had a robust conversation with people in Washington or other states that might have gotten further along than we have. And that'll be important, I think, in terms of data advocacy efforts, especially as it relates to health and disaggregated data. That's all I have. So the final slide is just a thank you. And please feel free to email me if you have any thoughts. Thank you.
Thank you, Karthik. Next, we have Kathy Vu from Asia Inc. Kathy? Oh, I'm sorry. Next, we have Noylin from CACF. Sorry about that, Noylin. You're on.
Great. Can everybody hear me?
Yes,
Hello?
Go ahead.
Okay, great. So I'm going to be talking about a campaign that we were involved in New York called Invisible No More, to look at how city and state agencies could implement standards on the way that they collect information, demographic information on Asian Americans and Pacific Islanders. Next slide, please. Oh, we can go to the next slide. So in New York, Asian Pacific Americans make up about 8% of the state population at about 1.8 million in New York. The stat here that you have is a little bit old. We're actually over 15% now. The majority of Asian American New Yorkers actually live downstate, so that would be the New York metropolitan area, which includes the 5 boroughs of New York City, along with Westchester, Rockland County, and the counties in Long Island, Nassau, and Suffolk. We have also been seeing growing communities in recent years of Asian American Pacific Islanders that are now settling in different parts of the state that haven't traditionally had a large population. Places like Buffalo, for example, we're seeing more and more folks settling in those areas. Next slide, please. So why data equity? We had an opportunity to take a look at the city and state data that's available at different agencies, and we found a few things that were, quite remarkable to us, considering that New York City or New York State is actually the state with the second largest Asian American population in the country. When we look at agency reports, what we often find is that data is often suppressed, or data is not standard the way that they collect information. So sometimes it's listed as Asian, sometimes it's Asian Americans, Asian Pacific Islanders, Asian American and Pacific Islanders. But at worst, we also see that oftentimes we're just lumped into other. And one other thing that we found too is, even though city and state agencies collect information on our communities, they often don't make it publicly available and it's not reported out. Some of the things that we hear is because of small sample size, or simply that they thought that the information was hard to aggregate, so it just wasn't made available. So ultimately, all of these together, really lead to the visibility of our communities, and this is why we started our campaign. Next slide, please. So there are currently 2 bills that are in New York. For historical context, we've actually been working on this campaign for about 3 years, and it was first introduced at the state level through then Assemblymember Grace Meng. Now she's a congresswoman for New York, and she worked with Senator Diane Savino to introduce the first version of this bill. We were very much inspired by the work that had been done in California, and we wanted to do something similarly. Since then, the bill has been picked up by new sponsors. So at the state level, it's Assemblymember Ron Kim and Senator Tobias Stavisky. We also have a city version called Intro 251, and the main sponsor is Councilmember Daniel Drum. So these bills really look at just 4 key areas. So one is a standard approach for government agencies to collect data, and we specify demographic categories for 18 Asian American categories and 4 Pacific Islander ethnicities. And the third piece is around collecting information on place of birth and primary language. And then lastly, we want to ensure that that data is made publicly available. Next slide, please. So we incorporated a number of strategies and activities for our campaign. The first part was around idea generation. We had an opportunity to look at the California bill, and we realized that a lot of the categories actually was not very representative of the Asian American Pacific Islanders that are in New York. So we convened a number of meetings with our partners to help prioritize which communities should be part of the different ethnic breakdowns. And then policy analysis was the next step. We started to research other legislation. So I'd mentioned California. We also held a series of phone calls and face-to-face meetings with many of our partners in Oregon, for example. We studied bills from Washington, and we also know that the Department of Education, for example, has been doing some work looking at disaggregated data. And then the other area that we closely looked at as well was through the Affordable Care Act, Section 4302, that offered some guidance around categories for Asian American Pacific Islanders. And so we're constantly looking at different examples from other jurisdictions to help shape this campaign. The third area that we looked at was, how do we train our partners and our allies to message and frame the importance of data equity? When we first began this campaign, we really framed it around equity and social justice. And what we found as we were meeting with different decision makers and policymakers that often didn't resonate with them. And so we had to think about other strategies to get them to support this. And what we found was particularly effective with various elected officials, particularly ones that did not have districts that had high AAPI constituencies, was to frame it around transparency and accountability. You know, there's shrinking dollars in the budget. We want to make sure that funds go to the most needy, to the most vulnerable. And how can you do that when the data that is available currently is actually not representative of the diverse communities that are in need? And then the other piece was also being able to tie how the city and state agencies can use this data to possibly draw down additional funds at the federal level for our state. And then lastly, what was very interesting in our conversations with the governor's office, for example, is they looked at better data in terms of what they were hearing from the tech industry, this idea about having open data and making it more publicly available. So that was kind of an interesting take that we didn't really think about. And as we see, you know, in talking with more decision makers, we do have to take different strategies. Our next area is around outreach and garnering support from other allies. What we found in doing this work, you know, data equity is not only an issue for AA and HPI communities, but it's also an issue for the LGBT community, for the disability rights community, and many of our allies from those communities had actually signed on to the work that we were doing. We had ongoing advocacy days and legislative meetings, and it was just very important to us to kind of monitor and see the political pulse and explore windows of opportunity. So like I mentioned, we've been working on this for about 3 years, and you know, it really wasn't until this year that we made a lot of headway in moving forward with the campaign. Next slide, please. So here's some of the key outcomes. We've been able to get over 100 organizations nationally and locally here in New York to sign on and support our data bills. At the state level, we've had a little bit of a harder time moving the bill forward. On one end, we have a very progressive assembly, and they've been able to take the bill to a vote twice, and it passed in 2013 and 2014, but unfortunately, we have a little bit of a harder time at the Senate, where we were not able to get it even out of committee, and those are just some of the challenges that we're facing at the state level. However, in the city, we were successful in getting 35 sponsors, which will essentially make the bill veto-proof. We had a hearing on May 11th, and that was a really critical piece for us to be able to move forward. Once that hearing is completed, according to the city charter, we have to move forward on a vote for it, and it's very likely that something will happen in the next month. What was exciting about that hearing too is there are 2 other bills in the city that were introduced. One, the collection of gender identity and sexual orientation, as well as a collection of mixed race. And so all of us work together to try to push forward this hearing and look at a more comprehensive data package. And then at the state level, we're currently exploring, instead of going the legislative route, if there's an opportunity for us to think about administrative policy to move forward a state version of what we want. Next slide, please. So some lessons learned, as I mentioned, it's just really critical for us to understand what are some of the models and examples that are happening in other parts of the country. So again, we've been working very closely with some folks in Oregon to understand how they're implementing their bill. In terms of the comprehensiveness of the different categories, we had shared some of the breakdowns that we saw from Oregon to the governor's, to the mayor's office of government operations to give them some examples. We continually have to engage our member organizations to really have ownership over this bill, and so that they can really see the impact that it'll have on their work, particularly social service organizations. There has been some issues around negotiation and compromise. So currently, right now, we're trying to figure out with the mayor's office about how to effectively implement this when it's going to be a complete overhaul for many of the agencies. And we also want to ensure that it's not an unfunded mandate and that it would be optional for them, which defeats the purpose of moving forward with these bills. We continue to build our relationships and get buy-in from different government agencies to really understand what are some of the key challenges that they see in implementing the data overhaul. And then lastly is taking windows of opportunity around understanding the political and policy landscape. I think one of the reasons that we were able to get so many sponsors at the city level and move it forward in very fast speed this year is, you know, we have a new mayor, we have many new city council, and they're very interested in looking at issues around diversity and equity and this bill in many ways would help them advance many of those goals. Next slide. And here's my contact information if you're interested in finding out more how you can support the campaign that we're doing. I'm happy to connect. Thank you.
Thank you, Noylin. There's a number of different ways for the participants, you all, to interact with our presenters today. If you logged in using the GoToWebinar application or the website, there is a raise your hand feature. We also are monitoring the questions section as well as the chat. So if you have questions for the presenters, or if you have would like to enter some additional questions or clarifications, please signal us by either using the raise your hand feature on the app or typing in your question. Can you hear me now? Let's continue on with Kathy Vu. Kathy?
Hi, everyone. Thank you so much for gathering here today to talk about the amazing work that's taking place across the entire nation. My name is Kathy Liu. I'm here with Asian Services in Action, located out in Cleveland and Akron, Ohio. And my portion of the presentation today would be to talk about partnerships, on how partnerships can be used to improve data and how some of this work can be translated to working with community health centers to identify health needs through disaggregated data. Next slide. And so what I'll be doing is just going over a little bit of background about Asia, some of the demographics that we have here in Ohio within the Asian American Pacific Islander, or AAPI community. And then I'll highlight one of the actual partnership projects that we did with the Ohio Children's Defense Fund, some outcomes and implications with some of the data work that we completed. Next slide. So just to give some background about Asia, we are actually a local nonprofit, multi-serving agency serving new Americans. Over a span of 1 year, we serve around 10,000 individuals, and technically we are the settlement house for the Asian community in Northeast Ohio, which is in Cleveland and Akron. Next slide. Here, I just wanted to highlight some of the work that we've done around data, just so that the attendees here kind of have an idea of the capacity work that we've been doing with data. We had some involvement with the Census Outreach and Education, also with the Midwest Regional Action Summit with the White House Asian American Pacific Islander Initiative, and then more recently acting as a navigator with the Affordable Care Act. Next slide. So to provide a background about our demographics in Ohio, statewide, we have, according to the 2010 census, we have approximately 250,000 Asian Americans and Pacific Islanders, making up 2% of the total state population. From 2000 to 2010, there's been a 49% growth of Asian American Pacific Islanders in Ohio, and specifically Northeast Ohio is the fastest growing minority population. If you were to look at it statewide, roughly 1/3 of AAPIs live in Greater Cleveland. The another third in Columbus, and then the remaining split up between Cincinnati, Dayton, and Toledo. Next slide. So one item I want to clarify is the model minority myth and why data is so important in the Asian American Pacific Islander community. So according to a 2012 Pew Research report, it indicated that Asians are the smartest and the wealthiest, when in reality, there's actually a 350% increase of unemployment compared to 38% of African Americans. Um, in addition, there's 80% of Asian clients are below the federal poverty level, with 42% of them having a language barrier and within the Chinese community, and then 41% within the Vietnamese community. So, as you can see from the points that I have below here, that there is this model minority myth. When we look at the data, there are definitely some disparities there. Next slide. So to jump right into how partnerships are essential when it comes to bridging gaps with the use of data, I wanted to take the time to highlight a project that Asia worked with the Ohio Children's Defense Fund. So this project was actually really fun. The objective was to identify the Medicaid eligible Asian American Pacific Islander children through a strategic communication plan, and to use data to develop this communication plan that could be implemented in the future. Next slide. So in this project that we worked with the Children's Defense Fund, we were able to map it out into three different project periods. Period one was focused on analyzing the data and mapping the data and the language access needs in Ohio. Period two was comprised of developing a comprehensive ethnic media list, and then period three was actually to develop the outreach and education plan. Next slide. So for the purpose of time, I'm actually going to only highlight the work that we did in project period one, which was focused on the data analysis and mapping. So in period one, the purpose was to determine the concentrations of AAPI individuals in order to enroll a targeted population of Medicaid of the uninsured in Ohio. Next slide. Um, what we did here, the objective was to use 2010 census data to determine AAPI demographics down to census tract level in order to specifically give um, our partners an area for targeted outreach and education that they would be able to do. And so what we did here was we determined citywide uninsured rates by race, and then we also looked at relevant demographic variables as well and went city by city. Next slide. This is just a list of the sources used to conduct the data analysis and mapping for period one. Here we have the 2010 census data that was used, and then 2011 American Community Survey estimates, and then 2012 American Community Survey estimates as well, along with the item breakdowns of the data sources within each variable. Next slide. So first what we did is we took a look at the Asian American Pacific Islander community and found out which each of the cities and found out that a majority of AAPIs are actually located in Columbus, Ohio, with Dayton having the smallest AAPI community population. Next slide. From there, what we did was we found the percentage of uninsured rates within each of the cities and put that in order of the highest uninsured rates to the lowest uninsured rates. With seeing that in having a small number of AAPIs, that information was not available with the 2011 ACS 3-year estimates. Next slide. After that, we actually broke it down more and took a look at uninsured individuals 18 and under by city as well, and broke it down by each city. So seeing that although Akron had the highest, uninsured rates, Columbus had a higher uninsured children rate. And in this here, we were able to break it down and list it down by city as well. Next slide. So what we did after that was we actually took the census data and all the sources and went down city by city to identify the ethnic breakdown of population size and uninsured rates. So what I pulled out here for the purpose of our conversation today was the breakdown within Akron, Ohio, one of the cities that we were taking a look at. So, according to 2010 census data, we were able to identify the ethnic breakdown of Asian Americans in Akron, Ohio. And you can see here through the disaggregated data, it actually shows, you know, that we have a very high number of other Asians, which falls into a majority of our refugee community, which is the Nepali and Burmese community, and also Hmong. And then we also go further down into the Asian, Indian, Chinese, Vietnamese, et cetera, et cetera, breaking it really down into, what does Akron, Ohio's Asian American Pacific Islander community actually look like? Next slide. From there, we also took a look at relevant demographic variables such as unemployment, and we were able to identify which census tracts have the highest unemployment rates within Asian American Pacific Islander populated communities. Because Medicaid was actually expanded in Ohio, we felt that this was actually very important to look at the unemployment rates because it also shows, it aligns with the federal poverty guidelines as well. The rates that I have here highlighted in yellow are actually the census tracts that are highly populated by our Burmese and our Nepali communities upon the refugee resettlement. Next slide. So, in summary, we were able to identify that there was a large concentration of Burmese and Bhutanese in highlighted census tract maps, which I just stated. And we also were able to use the map, which would be in the next slide, to show that efforts for outreach and education should highly be targeted towards the North Hill and Chapel Hill area, which are identified neighborhoods within Akron, Ohio, and also showing that in Akron, Ohio, there's alarmingly high uninsured rates for Asians. And in the next slide here shows the map that we use according to the 2010 census tract. So the next slide here just to highlight some final outcomes, the process for Akron was actually repeated for the remaining cities in Columbus, Cleveland, Cincinnati, Toledo, and Dayton, and show that each community and city needs were very different once the information was actually disaggregated by ethnic group. Uh, some highlights here is that the largest concentrations of AAPI children in Columbus um, were stationed in Columbus, and that Akron actually had a very high number of refugees in the concentrated tracts. In addition, it also showed that there was a smaller concentration of AAPIs in Toledo, Dayton, and that in Toledo, or excuse me, in Cleveland, there was a very high Chinese population. So, as you could just see from some of these overarching outcomes or findings from this period one, we could really use this data to make sure that the outreach and education that we do is targeted appropriately and resources are utilized efficiently. Next slide. Moving forward, this data was actually used to develop a comprehensive. We were able to look into each city and develop a comprehensive list of ethnic media across the entire state and target which ethnic media sources we speak most to which uninsured rates. And so in period three, we were able to develop a comprehensive 12-month outreach, education, enrollment plan with our partners. Next slide. In terms of implications, I think the take-home message that I would really like to send out today is for everyone here to consider how non-traditional partnerships can maximize resources to AAPI communities or other communities with health disparities. In addition, how disaggregated data allows strategic messaging and outreach to different AAPI communities, and to really encourage everyone to explore different opportunities to link to community health centers for linguistically incompetent healthcare services. So something that I didn't get to mention here was how this kind of work can be used and translated into community health centers. And an example that I just want to, I guess, mention really quick is um, how we use this kind of model to conduct focus groups within different ethnic groups to assess their needs for health centers throughout Cleveland. So I'd be more than happy to share any of that material with anyone if you were to reach out to me. And that's all I really have. So the next slide here is just my contact information. If you have any questions, feel free to reach out to me. Thank you.
Thank you, Kathy. And thank you to all the participants for bearing with us through some of these technical challenges. Before I introduce Zenith, I'd like to invite you all to participate in this conversation. There are a number of ways to do that. If you logged in using the app, the GoToWebinar app, you can raise your hand and that will signal us to unmute your mic and to have you enter into the conversation. You may also enter a question into the question box or participate using the chat. So now Zenith Hassan, Director of Empowerment and Advocacy at Asian Pacific Community in Action. Zenith? I'm sorry, Zenith, I think you're muted.
Can you hear me?
Yes, go ahead.
Okay. Thank you, Lloyd. Thank you everybody for joining us. And as you've heard from our partners about some of the movement around data advocacy for Asian American, Native Hawaiian, Pacific Islander communities, I wanted to talk about locally sourced data and how we at Asian Pacific Community and APCA, at APCA have worked on locally sourced data and what we did with a project that we call the Data Book. Next slide, please. So the Data Book, you can find this book on our website, apcaaz.org, and the press room. And you can see a little image of the Data Book. It's that blue icon on the right side of the screen. And this is a publication that we put together, and it contains a number of articles written by community members working in different health fields, and that we compiled them into this book, and with the help of many other partners, published it and disseminated copies of this book. And you can find a download link for an online PDF version of the publication. But what I'm going to talk about is this case study we did about the value and what went into producing this data book as a source of local data. Next slide, please. So we started this project because in the state of Arizona, and as you have heard everywhere else, there is limited publicly available data on Asian Americans, Pacific Islanders, and Native Hawaiians, especially when it comes to health risks and challenges that we face as a community. And the dearth of reliable information also means that many health issues in the community remain unknown to providers and to decision makers, to policymakers, and also that there is a lack of the evidence base in order to adequately really address some of the issues that we're experiencing in community, and the lack of funding available to tackle some of these health issues. Next slide, please. So in producing the data book, we had convened a coalition that we were currently convening for a number of things, but it was really about advancing health justice for Asian American, Pacific Islander, and Native Hawaiian communities. And we call this coalition Health Through Action Arizona. And so the coalitions are leveraged to produce the data book. The convening coalition, Health Through Action Arizona, were made up of individuals who really understood the importance of uplifting local community voices and uplifting issues, and who had an interest in telling the story of AA and HPI health. The coalition actually set out to identify practitioners working in the allied health professions in the local community in Arizona and Pima County and Maricopa County mainly, that could write about timely health issues that they were seeing in the local community. And because they were experts in their fields, it was natural that the final publication, the data book, reflected the concerns and ideas of the health and healthcare workforce in Arizona. Next slide, please. So as we were thinking about the strategy, we were really at the height of the SB 1070 drama, and this was around 2010, 2011, 2012. And there was this national narrative of Arizona being the racial profiling state. And essentially, SB 1070, many people thought that it was this state-sanctioned racial profiling law, and that it had this potential to impact public health and affect public safety concerns. And so the type of locally collected data that we were thinking about became a new way of understanding things that were happening in the community that might not be captured in other data sets. And as we are experiencing now, the climate in Arizona is such that we have new laws curtailing and defunding social programs, including access to Medicaid. So the issues raised in the data book were very relevant to laws like SB 1070 that created a great amount of fear in the community, but are also very relevant to the climate now in Arizona. And, you know, when I silent protest against the root cause of policies like SB 1070, there's a lot of vocal outrage and a lot of vocal protests around policies. But what we know, as those of us who work in the health field, is more about the silent protests that occur. And these silent protests are manifestations of disease. And we see these protests on manifest as untreated rape, untreated diabetes, untreated cancer, people delaying care, fewer opportunities for good nutrition, fear of accessing services, domestic violence increases, and an inability or inaccessibility of the healthcare system. And so it became an opportunity to tap local experts on a breadth of topics that would eventually support overarching policy recommendations protecting community health in the face of dangerous policies that work to dismantle public health programs. Next slide, please. So in the book, many authors provided sources for the data they provided and offered opportunities to delve deeper into many topics. In this way, the book was also provocative. And one of the goals was to help to stimulate the academic discourse on Asian American and Native Hawaiian Pacific Islander health risks and challenges so that people working in research and academia would see these topics and then start to develop dialogue, discussions, and research projects around the topics they were seeing to get to a more and more sophisticated level of data. And then also to start creating the evidence base to appropriately address community health issues. So in this sense, one of the priorities was to create a community-owned written record of community issues and targeted initiatives and resources that were available, and together that this would provide the necessary evidence and building blocks to advance the coalition's goals of impacting local policies to improve health. And so community organizations that provide resources are also often a place where local data can be found. And two of the movements that we highlight in the data book, Arizona South Asians for Safe Families is a local domestic violence hotline, completely volunteer driven, and they work specifically to improve cultural and linguistic access to domestic violence services. In 2008, following the U.S. and global economic crises, the volunteers who staffed the hotline reported a significant uptick in the number of calls they received, and they were able to track that uptick from one time period over the next several months and years. And so what we were able to see is that, you know, there was this surge in victim reports that coincided with things like the global economic collapse and Arizona's anti-immigrant policies. Now, it became clear, although it wasn't so clear why that uptick was happening, we documented these increase in phone calls. But what was clear was that this organization was a trusted community partner and that we should be working in partnership with organizations like these to understand what's happening in community and the trends that are occurring, not just when we pass policies, but during specific time periods when we want to know what's happening in the community. Local data can be found in organizations like this. The other aspect, the other campaign that we did was essentially a Know Your Rights campaign. And we did this campaign to address the fear that many people in our community experience to access services, especially healthcare. There's a great amount of fear because of language ability, and then the campaign then was to increase community awareness about people's rights to receive services and to receive services in their primary language. And secondly, to create the demand within the community on providers to ensure that these rights are protected and fulfilled. And so what we thought was that, when we do these Know Your Rights campaigns, people will be empowered with new knowledge and information about what they are entitled to and what their rights are, and also what their responsibilities are. We conducted this workshop in communities to over 300 individuals and counting. And during these workshops, we get to hear and able to document the issues that people are experiencing about cultural and linguistic barriers to care. Next slide, please. So the policy recommendations contained in the data book, the first one is really the importance of data disaggregation, as you've heard from a lot of partners before. And the second one is really ensuring cultural and linguistic access at all levels in our social society, like in healthcare, education, and social services. Those are just two of the policy recommendations among a list of about 10. And the final slide, the outcomes and the lessons learned. So often the lack of reliable data also prevents advocates from speaking out against discriminatory policies. And the vacuum left by the lack of data also means that advocates are less equipped to fight against the myths perpetuated about the communities, and that eventually result in damaging racial stereotypes, like, as Kathy mentioned, the model minority myth. Likewise, as we've seen with reproductive health laws, the data gap allows politicians to use our communities as political tools to create more harm. Arizona passed the prenatal sex and race selection law, which really said that, which essentially used Asian American women and Black women as political tools to defund abortion and abortion access. So since we published this book, we are using this data book as a discussion guide. And we really hope that we can continue to use it to talk to providers and to also increase visibility of these issues within community, within provider community, and within provider communities as well. And we want this to also be a reference for community health issues when few other resources exist. And that is all I have for that. But please access this data book at our website, apcaaz.org. In the press room, you'll see a link to download the publication to get a sense of what the book is and how it was put together. Thank you.
Thank you, Zenith. We're going to open it up for discussion and for conversation amongst our panelists. If you'd like to join in the discussion, please enter your question into the question box or use the chat feature. Let me start us off, and I'll direct this to Karthik, or really to all the panelists. Talk about the larger movement to improve AAPI data, what you're seeing nationally to advance and support, but also some of the challenges that this work has faced.
Thanks. So in terms of national, what I've seen, and I think we need to give a lot of credit for people who've been doing this work for years, if not decades. I think now, especially with the White House initiative, has been an effective partner, particularly in education and in health, and given where a lot of the commissioners are coming from, who come from the health sector, and also where that it's housed in education, I think helps. But certainly on the education side, a big barrier is that a lot of the progress has to be made at the state level or the sub-state level, school districts or counties and the like. And so that becomes a challenge. That certainly is a challenge that we see in California on the higher ed administrative data. What I'm hoping is that with federal guidance on newer data collections that need to at least, I forget the number of Asian American and Pacific Islander categories they're supposed to disaggregate on, but I'm hoping that that sets a new standard which will get state systems to also start going down that path of disaggregation. One other thing I should note is so much of our concern is about disaggregation that we don't pay sufficient attention to language support when it comes to provision of services, but also the relevant data that is collected from people. Just from a survey and administrative data perspective, we get inaccuracies by not disaggregating, which is where a lot of this model minority type of dynamics comes about, is that we have subpopulations that might be smaller that get drowned out by this larger finding for the race category. But you also have similar kinds of problems if you don't have data that's collected in language for people who have limited English proficiency. You get a picture of a population that might look better off than it actually is. So it's something that I think saying that the White House initiative is behind some of these advancements at the national level, I think helps provide some kind of rhetorical ammunition. But the key, I think, is to keep fighting and learning across states and other sub-federal kind of areas and see how we can build on each other's work.
Thank you. We have a number of questions coming in. First one for Kathy. How do you develop and prioritize the messages you disseminate, and how do you make them appropriate for lower level education audience?
That's a really good question. So it sounds like there's kind of two questions here. The first one is how do we customize it? So what we were able to do is making sure that you have materials translated, and then also making sure that the English version of the item being translated has like a appropriate reading level. You know how you could on Word you should be able to identify like what grade reading level that document is. And so a lot of times with items that need to be translated, the issue comes along with, being able to fund that. And so one recommendation that we would really give out to individuals out there is to look at your budget line items when you do some of your, your grant development, and identifying a section on the line item to go towards interpreting and translation services. That way, if you know that the community you're working with, you do have a language barrier, that you do have some resources allocated for that. So hopefully that answers both questions.
Sure. We have another question. How can advocates partner with state agencies in the state surveys, such as the BRFIS, the Behavioral Risk Factor Survey, the Youth Risk Factor Survey, to better collect, analyze, and report on Asian American and Native Hawaiian Pacific Islander data? How can advocates partner with state agencies? Panelists?
This is Kathy. So one recommendation is that when you do your own projects, is to invite them to your table instead of always kind of, sometimes, when we do our advocacy work, we're hoping to be invited to their table, right? And so one model that's worked really well with Asia is inviting, like the county health department to our table when we do some of our, projects that we have out there that may involve a portion of it with data collection. So subcontracting some of that work out to that area, or bring them to our table to join our coalition or anything like that.
Thank you.
Hi, this is Noylin.
Noylin, go ahead.
Oh, no, I was just going to say that I think it's really critical to build relationships with the research team that are part of these agencies, and have it early on before some of the surveys are actually implemented. We've been doing that here at CACF, and it really has opened up our eyes in terms of a lot of the challenges that they face in implementing, especially to communities who are LEP, and what strategies might be to improve folks' participation in the types of studies that they're doing. So that would be my recommendation.
Thank you. As a follow-up to the earlier question that Kathy responded to on smaller language communities, the community that we encounter here in Arizona speaks dozens and dozens of languages, and many times we specifically invest in smaller language communities, translating materials in particular for them because of a specific targeting or a high incidence, for example, within a Burmese community or with other smaller language communities. I think part of that is our internal analysis on where some of the specific needs or disparities exist.
Right, Lloyd. This is Zenith, and I would just add to that by saying it's also really important working with small communities to diversify the way that we collect information and the way we understand data. So using qualitative data sources, using things like focus groups and cultural consensus, and building from there is also an important strategy to getting better and more accurate data.
Once again, we're up close to the hour. Let me open it back up to the panelists for final thoughts.
Yes, this is Karthik. I'll just give one final thought, which is just building on that. I mean, I think that when we think about data, there is a temptation to just think in terms of quantitative and also to think in terms of national or administrative data collections. One of the things I'd love to see, and this is something that I brought up in the data summit that we had, is to see if we can use data as an organizing tool to start collecting our own data, but still to have as high standards as possible in terms of, using some of the same questions that are used in some of these other national surveys, so that even if people say that the sampling isn't quite the same as those national collections, that we're using some of the same instruments to at least build our own capacity to tell our stories, because that's the big thing about data, is that if you don't have rigorous collections, it's difficult to get the attention of funders, of government agencies, who might say that, what you have are these anecdotal stories, but I want something more concrete. So I think that that's something, hopefully, that we can develop moving forward, and we would love to be part of that conversation, is figure out how we can start doing that.
We're at time. I'd like to thank our panelists, Karthik Ramakrishnan, Kathy Vu, Noylan Abesamis Mendoza, and Zenith Hassan. On the screen, you'll see a link to our survey. We'll also send that out by email to webinar participants. Once again, thank you very much for joining us.
Thank you.
Thank you.